This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Think of your blood like a busy highway. When everything is working right, your blood traffic flows smoothly, but when there's an injury, an accident, your body needs to deploy a construction crew, the clotting factors, to patch the hole and stop the bleeding. PTT, Partial Thromboplastin Time, is basically a stopwatch. It measures exactly how many seconds it takes for that construction crew to show up and finish the patch. A normal PTT is typically 25 to 35 seconds. For a version of the test that uses an activator, known as an APTT, the normal range is 30 to 40 seconds. Why paramedics care about the stopwatch? In a long ambulance ride, paramedics have to be detectives. If a patient is on certain medications or has a medical condition, their construction crew might be too slow or too fast. If the PTT is too high, the crew is too slow, the blood takes too long to clot. If the patient gets even a tiny cut or bump during the ride, they could bleed way more than an average person. If the PTT is too low, the crew is too fast, the blood might be clotting when it shouldn't, which can cause dangerous traffic jams in the veins, like clots that could travel to the lungs, heart, or brain. How it changes the trip. When a paramedic knows a patient's PTT value, it influences how they manage the transport. 1. Planning the ride. If a patient has a very high PTT, the paramedic knows they are at high risk for bleeding. They will choose a route that is as smooth as possible, avoiding bumpy roads or sudden braking, because any physical trauma could turn into a serious medical emergency. They might also pad the patient's bed to prevent even minor bumps. 2. Monitoring. During the ride, the paramedic becomes a watchdog. They'll check the patient constantly for stealthy signs of bleeding that you might not see at first, like bruising appearing under the skin or blood seeping from an IV site. They have to monitor the patient like a hawk. 3. Decision-making. Medication. If the patient is on an anticoagulant, the PTT helps the paramedic decide if the medication dose is just right. If the PTT is too long, they might need to titrate so the patient doesn't bleed out. The sending hospital may provide a scheduled protocol, and the clever paramedic will utilize timers to ensure changes aren't delayed or missed. Urgency. If the patient presentation indicates risk of a major clotting problem, the paramedic might decide they need to bypass the intended destination and head straight to a hospital that has specialized equipment or blood products, like plasma, to fix the clotting issue. They may even decide to divert to the nearest hospital for patients exhibiting stroke or cardiac symptoms. The bottom line, for a paramedic, a lab value like PTT isn't just a random number on a report. It's a piece of information that tells them, how careful do I need to be? A normal PTT means they can focus on standard care. A crazy PTT turns the ambulance into a cradle, where every bump and every dose of medicine is calculated to keep that delicate balance in the patient's blood perfectly under control until they reach the hospital.